Well, here in Germany, the health system is still coping well, but the country's vaccination program continues to be dogged by problems. After a crisis meeting with regional leaders and representatives of the pharma industry, German Chancellor Angela Merkel urged Germans to be patient. She said most would be offered the jab by the start of the autumn.
Only around 2 million people have so far received a COVID vaccine in Germany. The rollout has got off to a slow start. On Monday, political leaders spent the afternoon discussing with the bosses of medical firms how it can be speeded up. But despite delays, Chancellor Merkel repeated her clear promise. By the end of the third quarter, by the end of the summer, we'll be able to offer every citizen a vaccine. That said, the manufacturers have also told us today that something that they can't foresee can always occur during production. And they also all have no prior experience of this. But I think the numbers for the different quarters overall are already very relevant. One reason the Chancellor is confident she can achieve her targets is that the producers predict they will make ever more vaccine. Official projections suggest the government expects a total of 322 million doses will be available this year. But production cannot be ramped up immediately. The current shortages are likely to last for at least 2 more months into the second quarter. Looking back, the EU approvals process was slower than in some other places, in part because it insisted on full approvals rather than provisional ones. The Chancellor defended that cautious approach. More money would not have created more capacity. The order from BioNTech was in fact rather large. The Americans have more options, but our initial order of 200 million doses was very high. And we had hardly begun to look at the production site in Marburg in Germany when the European Commission was already negotiating a second contract. But such explanations are likely to be of little comfort to people, especially the elderly, who have been told to expect to get the vaccine, but are so far struggling even to get an appointment. The important thing is that the vaccination date is truly reliable. People get really frustrated when the appointments cannot be kept because of delivery bottlenecks and limited resources. That is what annoys people, not so much that they might call up and ask 5 times. Frustration is growing as the lockdown drags on. The government has set out a pathway back to normality with promises of vaccine. Now they will face even more pressure to deliver.
Let's bring in our chief political correspondent, Melinda Crane here. Melinda, there was massive pressure on German political leaders at this vaccine summit to deliver more than just words. Did they?
Well, you know, one German newspaper is calling this the placebo summit. But I think that's wrong. A placebo has no effective ingredient. And at this summit, a very effective ingredient was produced and exchanged, namely more facts and more information. It was clear from what we heard in the press conference that the politicians at both federal and state level had not fully understood the complexities of the supply chains of the pharmaceutical firms, some of which took part in the summit. It was also clear that the federal government hadn't fully understood the states' need for more reliable information for planning purposes, even if that information includes the fact that vaccine quantities in this part of the year until the second quarter will be lower than many politicians had hoped. So what we saw at the end was the politicians coming together to say that they understand now what the supply situation is, that they will develop a more detailed roadmap for the rollout by the middle of this month. And we saw essentially more reliable facts and information, both for policymaking, but also for the public, which is exactly what we heard the person in the report calling for.
Chancellor Merkel says that all Germans will have access to a vaccine by the end of the third quarter. That's 8 months from now. How realistic is that, and how is that message being received?
Actually, she's promising that all Germans who want to be vaccinated will have that opportunity by the end of the summer. And the various tables of vaccine deliveries that were produced as a basis for discussion at this summit absolutely bear her out. As we heard in the report, the vaccine quantities will remain limited in this first quarter. The government's been saying that all along. The next 8 weeks will remain difficult. But after that, vaccine delivery will pick up significantly, 70 million by the end of June and 126 million doses throughout the summer. So basically, it looks like the Chancellor absolutely is right, and experts bear her out on that.
Melinda, thank you very much. That was our chief political correspondent, Melinda Crane. Now, to the coronavirus crisis, the pandemic is pushing hospitals in Portugal to the brink of collapse. The country has the highest number of new cases in the world, mainly because of the new British variant of the virus spreading out of control. The situation is so critical that other European nations are now coming to the country's aid. Spain and Austria have offered help. Germany is sending a team of doctors and equipment.
This is the second field hospital being built on this university campus in Lisbon within a few days. This time the basketball court is being converted into a temporary clinic for 150 COVID patients. João Roquette usually runs the university's sports facilities, but in recent weeks he has also been working as an emergency helper.
The sport facilities, they are very flexible, and it's very easy to adapt the sports hall to a field hospital. More difficult is to put inside the human resources for running this kind of hospital.
Doctors from Germany are among those preparing to work at this temporary corona hospital. They are part of the medical team from the German military that is set to arrive in Portugal on Wednesday. Lisbon's largest hospital, right across the street from the university campus, has been under massive strain for days. Almost all of Portugal's intensive care beds are occupied, and there is an acute shortage of equipment.
The pressure on Portugal's health system seems to become unbearable. Ambulances often have to wait for several hours in front of the hospitals before their patients can be admitted. And many fear that in the coming days, numbers will continue to grow.
João Roquette is getting things set up for the staff of the makeshift clinic. He had mobile homes installed for the medics to take breaks during their long, exhausting shifts. The mobile home project began 2 weeks ago and is already supported by more than 200 volunteers and 50 vehicles. The work here is pretty emotional. Last week a doctor knocked on my door and wanted to thank us. She said she often felt desperate. I think in addition to a place to sleep, the medical staff sometimes need moral support. The volunteers think that solidarity is the one positive thing to have come out of the crisis. And the fact that Germany and other European countries are now offering help is giving an international dimension to that feeling of solidarity.
Let's take a look at some of the other developments in the pandemic. Investigators with the World Health Organization are searching for the origins of the coronavirus at an animal clinic in Wuhan, China. This could provide insights into how the virus might have crossed from animals to humans. The U.S. is ordering millions of rapid home tests for COVID-19. They can detect the virus in 15 minutes with 95% accuracy. And schools and stores in Austria are set to reopen next week. Officials say the students will be tested regularly for face-to-face lessons. Wearing masks and social distancing will still be required at retail stores.